Hello everyone. Now after family history and SES, we have to write down the maternal history in which we have to write down the mother's age, weight, height, any chronic maternal disease if present, then about the treatment for this condition. Example, mother is suffering from hypothyroidism, then about the thyroxine we have to write down. Then mental health of the mother, substance use, alcohol, tobacco, anything mother is consuming. Then about the maternal and paternal genetic history we have to write. After that we have to write the previous obstetric history in which GPA. G stands for gravidity. So total number of confirmed pregnancy is G. Example, if a mother is having G5 means 5 times she is pregnant. G5. Then we have to ask about the parity, number of infants that are alive and dead. We have to write. So example, if mother is having uh, two live baby and two expire. So we will write the 2 plus 2 live plus 2 dead babies. Death of the 2 babies has occurred. So in bracket we will write down the total 4 babies, one abortion also there. So we will write down A1. So total number of pregnancy she had 5. 2 live baby she is having and 2 expired and 1 abortion. So we have to write down GPA and then again we have to ask about the cause of death, age at the death, and also we have to ask about the birth weight of the previous infant, any problem with the previous infants, neonatal jaundice, preterm delivery, congenital anomaly, we have to ask. So this is the way to write down the obstetric history. After the obstetric history, we have to write down the antenatal history. We can divide the antenatal history into first, second, and third trimester. So in first trimester, we have to write down last menstrual period, antenatal checkups were done or not, then hemoglobin and blood group of the mother, any history of fever and rashes and any post-auricular lymphadenopathy during the first trimester because it suggests the torch group of infection. So if baby is having the IUGR with hepatosplenomegaly, then we have to ask this history. It is occurred in the first trimester or not. Then about the exposure to drugs, radiation, any addiction or about the folic acid supplements. In second trimester, we have to ask mother failed the quickening or not and about the TT injection, at least 2 doses received during the pregnancy. Then iron folic acid tablets were continued. In second trimester, folic acid tablet ideally should be started 1 month before conceiving and should be continued. And iron should be started in second trimester. Then about the USG done during the second trimester also and what was the finding and mother is having any illness example PIH, diabetes, hypothyroidism or any infection HIV, HPS which is going to affect the baby. We have to ask the history and any bleeding or leaking PV present during the second trimester we have to note down and antenatal checkups how many times taken during second trimester. Then in third trimester how much weight gained by the mother. We know mother generally gain the 10 to 11 kilogram throughout the pregnancy and most of the weight gain occur in third trimester. So we have to ask how much weight gained by the mother and supplements were continued or not. Then again we have to ask any bleeding during the third trimester, any infection illness and USG was done or not. We have to ask in USG any polyhydramnios or oligohydramnios or any congenital malformation was mentioned or absolutely normal. Any history of drug intake, exposure or radiation. After antenatal history, we have to take the natal history, in which we have to mention either baby is term, preterm or postterm, hospital delivery or at home delivery was take place. Then mode of delivery, either LSCS. If LSCS, then also write down the indication, or normal vaginal delivery or assisted vaginal delivery. Then we have to ask baby cried immediately after birth or not. If not cried, then we have to label birth asphyxia. Baby passed meconium or not, we have to ask any resuscitation was done at the time of birth, any history of prolongation of labor, also mention the birth weight, and also we have to mention breastfeeding was started immediately within half hour of birth, or if not, then at what time of life, how many hours after birth breastfeeding was given to the baby. After natal history, you have to mention postnatal history. So if the baby is having any significant problem during the neonatal period after birth, we have to mention in the postnatal history. So any feeding problems or any other feed before starting the breastfeeding, label as a prelactal feeds given to the baby or not. Baby has passed urine or stool timely within 48 and 24 hours respectively. And when the umbilical cord fell down, if the baby is coming after 7 to 10 days of life, then umbilical cord will not be there, then you have to ask. Baby was admitted in NICU for any complication, example for jaundice or any convulsion or any other issues. Then we have to mention in detail in postnatal history. Otherwise, we can mention postnatal history was non-eventful and not significant. Thank you so much.